Massage therapy techniques. That's what MT stands for, if you haven't noticed. This is the intro to touch, the very beginning. There it is. What are we going to learn in this slide? We're going to learn something called touch awareness, palpation basics, body mechanics, and professional draping. And I'm going to try to record out there. So I might need help from some of you techie people on like the hands-on stuff. So what is touch? Touch is the primary tool of massage. It communicates safety, intention, and professionalism. The term therapeutic touch is practiced by massage therapists. So our touch is considered therapeutic touch. That may or may not be a question on this quiz. Right? Here are some types of touch. So you have something called superficial touch. That's light pressure. It's usually more sensory. So imagine like doing a light stroke or a feather stroke on somebody. Or like you feel like the wind blow your hair and it like kind of tickles. That would be your superficial touch. Then we have something called static touch. Static touch means you are touching without movement. So if I were to just place my hand on you and not move it, that is what we would call static touch. The opposite of that is dynamic. Dynamic means we are moving it. So we are either gliding, kneading, or doing some kind of movement with our touch. Massage involves like all of these, right? Then there's deep touch. This is what we would consider the firmer hand or the deep tissue. This applies a targeted pressure to the muscles and connective tissue. And we are going to learn that deep tissue does not mean I'm going to use all the pressure I can summon. So it is a firmer touch, but it doesn't necessarily mean it needs to hurt. So let's debunk that one. It can hurt. The effects of touch. Why do we do this? It actually helps reduce stress and anxiety. We're going to learn a lot more about the effects as we get through the program. And by that point, you should be able to answer somebody's question if they say, well, what are the benefits of massage? Because right now you're probably like, feels good. And for you who have not got a professional massage, you're like, I got nothing. I'm just here. This sounds like a cool career. And it is. So it reduces tension and anxiety. It also improves your circulation throughout the body. And obviously relieves tension in the muscles, which then relieves pain. It enhances body awareness. It also encourages the client to trust you, and it sets up a good rapport between you two. What the heck is palpation? So the definition says it's a systemic use of hands to assess tissues. So palpation means we are using our hands to try to figure out, okay, this spot might feel a little tight. Oh, I feel a little knot here. This spot feels a little warm. So we're going to feel all kinds of things with our hands. Palpation skills are really like the number one skill that you need for doing this. And we're going to work on that every week. So when we palpate somebody, this allows us to kind of identify if there's tension. We can locate bony landmarks. And by that, what I mean is in kinesiology, you will learn that the muscles attach to the bones. Well, they attach to the bones in certain areas to help you move, right? It's like a whole scientific and like mathematical type thing. It's super awesome. So we're going to find those bony landmarks to try to identify where that muscle attaches to the bone. Palpation can help you detect if there's swelling in the tissue, knots, asymmetries, so you'll be able to tell if one side is way different than the other. It helps you plan the appropriate technique for recovery. because not everybody needs the same treatment. You're not going to learn a routine and literally give everybody the same routine. Each massage, as we learn, each client is like a whole new fun like puzzle to solve. How do we accurately palpate? So we're not going to just dive in and start poking people. It tends to be a nice, slow, gentle touch at first. So we're going to use the pads of our fingertips, not like straight down at the top. The pads of the fingertips, the pads of your hands, right? So you want to start light when we're working on somebody. Then gradually increase that pressure so that you can start feeling different layers. Because if we push too light, you're not going to feel anything. And most of you are going to be too light, and we're going to work on pressure the whole time. When you're palpating, I want you to move slowly and deliberately. So as we learn muscles, you are going to be palpating along the length of the muscle and the direction of the muscle. Some techniques will have us palpate against the grain of the muscle. It's fun. Then we're also going to compare both sides, left and right, of the human body. Most of us are going to have a dominant side that tends to have more muscle tone. And sometimes when people get injured, they start compensating and using more of one side. I don't know if any of you have ever broke or sprained your ankle or foot, and then you have to use basically the other side, and then that side starts giving you aches and pains. That's kind of what we're going to be dealing with is asymmetries. Some tips. We need to constantly communicate with our client. In this, it says, I am feeling for tight areas. So sometimes as soon as you touch the client and you're trying to put lotion on them, they're like, oh, you can go harder. Thank you, sir. I'm just trying to assess your tissues and palpate. Can you just give me a moment to rub the lotion on? All right. So sometimes if you're doing something a little weird that might not be like massage and you're just trying to feel around and palpate, just be like, I'm just trying to see what this side feels like compared to this side. So you can communicate what you're doing so they're not like, what in the heck is she doing to me? Maintain proper hand posture and ergonomics. If you do not have good body mechanics, you are going to injure yourself. And then say goodbye to this job. So we are going to learn how to be mindful of that and prevent injury as best as possible. You will most likely have tendinitis, and you will be welcome to my club of massage therapists with tendinitis. That's just because of the repetitive motion we're doing constantly. And it's usually in the wrist or elbow. When we are palpating, we want to palpate systematically, so whole body, head to toe, or you might do region specific. Maybe you're working on the arm and you're palpating the arm. Today we're going to do some palpation on the arm because it's the easiest thing to get to. And then maybe a little bit of scalp stuff. I lied to you the other day when I said, oh, we're going to do a head massage. I was like, that's not for a couple weeks. What am I talking about? So we are going to do a little bit of head, but mainly arms. Don't worry, we won't mess up your hair too bad today.
No, it's not bad. It's dirty.
Dirty.
I feel bad.
Who cares? I dry shampooed today. No shame in my game. I'm not washing it again. I'm tired. All right, principles of body mechanics. Let's learn a little bit about body mechanics. There's going to be 2 moves in massage world that you're going to have to learn. You're going to have to practice. And if you don't, you're going to hurt your back. Capiche? When we are working on clients, we want to work as close to the table as possible. So what I mean by that, say this table is my massage client. I'm not going to be a foot or 2 out, bending over like this to try to get to them. I'm going to be right up on the table, working on them so that I have a nice straight back. I'm not hurting myself. Because it really sucks when you're doing a massage stroke and your back goes out. Yeah. And you're like doing this, wishing you could like rub yourself, but you have to, continue your massage. We want to keep our spine neutral. Avoid excess bending, twisting, or reaching. We want to use our body weight, not just our arm strength. We're going to learn a lot about this. A lot of people think that all the strength comes from just our hands and our arms. No. Remember the other day I said our massage table is our best tool? It is, because we are literally just using our body weight and sinking in and not having to use our strength. So some of the tiniest people give the deepest massages just because they really know how to use their body to kind of get that weight behind them. They just cheat. They're alien. We want to keep our shoulders, hips, and knees kind of aligned, because if we're off balance, one, we're going to hurt ourselves or fall over. I've heard of a lot of people falling off their stools. I've not fallen off my massage stool yet. Yet, knock on wood. When we are doing different massage strokes, we want to be able to shift our weight smoothly. That's why we're going to learn these two techniques. And we want to maintain a wide, stable stance. I should be able to kind of go up to you, nudge you, and have you not fall over. So that's what I'm looking for. When we are trying to do deep pressure, you guys are going to learn how to use everything from your elbow down to your fingers when working on people. I use a lot of forearms and elbows when somebody wants me to beat the living daylights out of them. They're like, oh, you can't hurt me. I bet I can. But that's not what it's about. And also it helps save your hands. So we're going to not only use our fingers and our hands, we're going to use fists, elbows, and forearms. And some techniques, some modalities include knees and feet. Ha! I'm not going to make you guys use your knees and feet, but this is the horse stance. I'll go over those papers in a second with you guys. The horse stance looks like somebody's getting up. Getting up. So the horse stance would involve keeping your knees apart, slightly bent, back straight. So we're trying to see how her knees and her ankles are kind of about the same. This is the horse stance, all right? Makes sense? So if I were to walk by you and you're standing like this, most of your legs are kind of keeping you where you need to be, all right? Horse stance. Next one, archer pose. This is the most used massage pose because you are staggering your legs like this. Staggering, I can't speak. All right, so one foot's forward, front knee is slightly bent a little bit. The archer pose, think of you with a bow and arrow. That's the pose we're doing. Keep your back straight. Keep your back of your leg straight. The reason why this is the most popular, if this is a table, imagine this is my massage table, and I'm at the end of the table, I can work on their leg and be as close to the table as possible. Make sense? And then this is a really easy thing. I can kind of shift my weight back and forth instead of using my arms. See how my arms aren't moving and it's just my body weight. So we're going to learn that today. And draping. Why the heck are we doing draping? It protects our clients' privacy and their dignity. Right? Keeps them warm, keeps them comfortable, keeps them safe, right? It creates that professional boundary that we're striving to get back. And also provides access to treatment areas in a safe and respectful way. Never are we just going, I know different countries do things weird. Never are we just going to put a little towel over the pubic area and just have everything out. So if we are working on an arm, unless the client doesn't want their arm under the blanket, that is the only thing that's exposed. We work on the arm, put it back under and keep it warm. Then we work on the next arm, take it out, work on it, put it back away. Same with the leg. So each body part is going to be undraped while we're working on it only. Does that make sense? Does that make you guys feel better about working on each other? Yes, it should. Some draping techniques. I know the other day we made the tables, and you see that there's 2 sheets and a blanket, right? So some countries or some states or whatever won't always use a blanket, and they might just have 2 sheets or a sheet and a towel, like a big giant towel, like a bath blanket or whatever. So that's why I put towel in here. Use a top sheet and or a towel. Expose only the area being worked on. Keep the edges tucked and smooth. The reason for this is we don't want things to fall out or have them feel drafty. Avoid draping when moving to new body regions. Or adjust, adjust, don't avoid. That's weird. Adjust your draping. So if you need to constantly readjust and retuck things for the comfort of your client, go ahead, all right? And sometimes they're a little more wiggly, so things get moved around. Tips. Sometimes you want to explain draping to your clients, especially those who've never had a massage in their life, at least a professional one. So what I do when I get my newbie massage clients, I literally go over everything with them. And that's what I'm going to do with you guys today. I'm going to dumb it down, all right? And act like this is the first time you've ever seen this, because some of you it is. Ask the clients to confirm comfort. So usually the first thing I do as soon as I get back in that room after they've undressed and I gave them, time to do that, and then they're on the table, they're covered, hopefully in the position you told them to. That's a fun time. You want to check in with them. Are you warm enough? Do you feel comfortable? Something like that. And then you can tell them that you can adjust the temperature of the table or whatnot. In my room, I have a fan that oscillates. So depending on how cool it feels in there that day, and how hot the client gets or me, I can adjust my fan or keep it from spinning on us and just have it facing the kind of the wall area. So I kind of will do that and be like, if you get cold, let me know. Some people are like, turn that on high, turn the table off, and they're like kicking off the sheets. So everybody's different. So that's why we're constantly asking them if they're comfortable. We also want to always avoid unnecessary exposure. So always cover back up that area that you just worked on. Some clients might need extra linen for small areas or for sensitive clients. It also depends on the thickness of your blankets and sheets. Some people want a thicker, warmer blanket. Some don't at all. Sometimes we have a very large client. You might need to purchase a couple, we use kind of twin sizes. You might want a couple full size sheets just because not everybody's the same size, right? And then when draping, confidence is key. Fake it till you make it, right? So maintain a calm and professional demeanor when we are learning to drape with clients. They need to feel like you know what you're doing, all right? There's that. That was quick. So I'm recording these. I'm going to stop this. Peace out, A-Town. Peace up, A-Town down. That's how it goes.